Welcome back to Medicare Mondays. Today's session is pre-recorded. Today's topic is about Medicare fraud prevention and Medicare fraud schemes. Today's session does coincide with Medicare Fraud Prevention Week. Medicare Fraud Prevention Week is June 5th to June 11th. This week, we focus on the actions everyone can take to prevent Medicare fraud, errors, and abuse. Medicare Fraud Prevention Week is hosted by the Senior Medicare Patrol, also known as SMP. The SMP is a national program to educate Medicare beneficiaries about Medicare fraud, errors, and abuse through outreach and education. Learn how you can protect yourself or your loved ones from Medicare fraud by joining every day of Medicare Fraud Prevention Week for a different message on the national social media platforms or by connecting with your local SMP. Follow us on Facebook at riship.smp or visit the Senior Medicare Patrol Resource Center page at smpresource.org. Why is Medicare Fraud Prevention Week important? Considering Medicare loses billions of tax dollars each year due to fraud, errors, and abuse. Everyday related to problems affect people across the country, often costing them time, money, and well-being. Medicare fraud, errors, and abuse also affect current Medicare beneficiaries because they result in higher Medicare premiums and waste money that could be used to increase and improve healthcare services. Medicare-related errors contribute to this annual loss, even though errors can be honest healthcare billing mistakes. However, repeated errors by doctors or providers could be considered a red flag of potential fraud and abuse if not corrected. How to take part in Medicare Fraud Prevention Week. If you're a Medicare beneficiary, start the week by learning how to read your Medicare statement. Generally, you get these statements every 3 months. If you want to read those summaries sooner, make an account on Medicare.gov and you can get them each month. For caregivers, help by educating yourself and your clients or loved ones on how to prevent and detect healthcare fraud, errors, and abuse. Be on the lookout for things like boxes of knee braces, also known as Medicare equipment or durable medical equipment, lying around the house. This is a common scam and may mean your client or loved one has been a victim. Remind your clients or loved ones to never give out their Medicare number or other personal information over the phone. If you're a family member, help by talking to your loved one about protecting their Medicare number just like it was a credit card number. Encourage them to check their Medicare statement for fraud, errors, and abuse, and never give out their Medicare number over the phone for any reason. Help your loved ones create a Medicare.gov account to access their claims online or remind them to open and review their statements that come in the mail every 3 months. You can also register their numbers on a do not call list to opt out of all the mailings. How to take part in Medicare Fraud Prevention Week continued. Partners and professionals. If you are a partner or professional, help by sharing SMP information on social media. Refer clients and consumers to the SMP and inviting the SMP to speak during a shared event. Identify ways to collaborate on mission-related topics and information. If you're a healthcare provider, help by talking to patients about healthcare-related scams such as those related to durable medical equipment, genetic testing, or new plastic or chipped Medicare cards. Reassure them that your office and other doctor offices are not going to call to offer them services or equipment. Teach them that products and services should only be ordered by doctors they regularly see, like you, and that needed medical items should never be ordered through TV ads or unsolicited calls. If you're a community member, help by looking out for your older neighbors. If you overhear someone talking about Medicare, don't be afraid to give information about Rhode Island SMP and SHIP. Encourage those to know to talk to a trusted source about their Medicare information and tell your neighbor about the most recent Medicare scams. Consider volunteering with Rhode Island SMP. What is Medicare fraud, errors, and abuse? Medicare fraud involves intentionally billing Medicare for services that were not received or billing for services at a higher rate than actually justified. Medicare errors are providing and billing for healthcare services involves many complicated steps, which may lead to errors. Most Medicare payment errors are simply mistakes and are not a result of physician, provider, or suppliers trying to take advantage of the Medicare system. Medicare abuse occurs when providers supply services or products that are not medically necessary or do not meet professional standards. What are some of the examples of fraud, waste, and abuse? Such as billing for services, supplies, or equipment that are not provided, billing for excessive medical supplies, obtaining or giving Medicare number for free services, treat any offer or free service in exchange for your Medicare or healthcare identification number with caution, improper coding or to obtain higher payment, unneeded or excessive x-rays or lab tests, claims for services that are not medically necessary, using another person's Medicare number or letting someone else use your number to obtain medical care, supplies, or equipment. How can you prevent Medicare fraud, errors, and abuse? It's by preventing, detecting, and reporting. Remember to take what you know and pass on to friends and loved ones who might not be familiar with this information. How to prevent yourself and others from Medicare fraud, errors, and abuse. One step that you can make is make sure you read your Medicare summary notice. It is not a bill. It is a notice that people with original Medicare get in the mail every 3 months for their Medicare Part A and Medicare Part B services. The Medicare summary notice also allows you to see all your services or supplies that providers and suppliers billed to Medicare during the last 3 months and what Medicare paid, the maximum amount that you may owe the provider. When should you get a Medicare summary notice? You'll usually get that every 3 months. If you get any services or medical supplies during the 3-month period. If you don't get any of the services or medical supplies for the 3 months, you may not receive an MSN statement. Did you know that you can get your MSN statement electronically if you choose eMSNs? You can get an email with a link to your MSN for that month. You won't have to wait 3 months for the paper copy in the mail. You can sign up to get them through your Medicare account at medicare.gov. Preventing yourself and others from Medicare fraud and abuse. Who sends your Medicare summary notice? It's always going to come from Medicare. What should I do if I get this notice? If you have other insurance, check to see if it covers anything that Medicare didn't. Keep your receipts and bills and compare them with your Medicare summary notice to be sure you got all the supplies, services, and equipment listed. If you paid a bill before you got your notice, compare your MSN with the bill and make sure you paid the right amount for your services. If any item or service is denied, call your doctor or other healthcare provider office to make sure they submitted the correct information. If not, the office may resubmit. If you disagree with any decision, you can file an appeal. Your MSN gives you step-by-step instructions on how to file an appeal. How to detect Medicare fraud, errors, and abuse. Review 1. Review your Medicare summary notice every 3 months if you have original Medicare. 2. Review your explanation of benefits received by your health insurance plan every month. When reviewing your MSN or EOB, look for services, products, or equipment you didn't receive. Maybe you got double charged or items your doctor didn't order. If you find items of concern, call the doctor or company in question and ask them about the potential mistakes. Call your insurance company if you still have questions. Access your Medicare information at medicare.gov. You can also request to use a My Healthcare tracker provided by Rhode Island SMP to compare appointment information you recorded with what is printed on your Medicare summary or explanation of benefits. Take your tracker with you to your appointment and make sure you record information from your appointments. When your Medicare summary notice or other statements arrive, compare them with this Medicare My Healthcare tracker. Contact Rhode Island SMP for help when needed at 1-888-884-8721. Common Medicare fraud scams could include ambulance scams, COVID-19 scams, durable medical equipment scams, genetic testing, home health care, hospice, medical identity theft, Medicare marketing violations and enrollments, nursing home care, outpatient mental health care, pharmacy, or prescriptions. In 2018, Medicare updated the Medicare card from containing a person's social security number to a random identifier that includes numbers and letters. That was the last time the card was updated, and there is no plan to update it again. Report potential Medicare card scams if somebody calls you claiming you are getting a new plastic Medicare card. Medicare is switching to a card with a chip in it. It's a new year, so you need a new card. You need a black and white card. You need a Medicare card to see if you receive your new one yet. Or they want you to verify your Medicare number so they can confirm that you have the correct Medicare number. What you can do to stop these scams: do not answer calls from numbers that you don't recognize. Do not confirm your Medicare number or answer yes to any of these questions. Guard your Medicare card number like it was a credit card number. And don't share your number, laminate it, make copies, or let anyone else make copies. The most occurring Medicare fraud scam is COVID-19 test kits. If you are receiving unexpected COVID-19 test kits, the SMP can be heartening. The SMP has been heartening report about unwanted. The SMP has been hearing reports about unwanted, unexpected, and too many kits being delivered. It's a signal that somebody may have been using and could continue to use senior Medicare information to improperly bill the federal government. Remember to protect yourself. Beneficiaries should be cautious of unsolicited requests for their personal medical and financial information. Medicare will not call beneficiaries or offer COVID-19 related products, services, or benefit reviews. Be careful, scammers are selling fake and unauthorized at-home tests, kits to exchange for your personal and medical information. Scammers are also sending COVID-19 home kits to Medicare beneficiaries and billing Medicare for reimbursement. If you received any of these and you did not order them, please call Rhode Island SMP at 1-888-884-1221. Most occurring Medicare fraud schemes, marketing. Some of them, another scam is Medicare marketing violations. Unlike Medicare and Medicare Advantage Part C and Medicare prescription drug plans that are administered and marketed and sold by private insurance companies, the Center for Medicare and Medicaid Service, also known as CMS, has guidelines for these marketing Part C's and Part D's insurance to protect Medicare beneficiaries from manipulative and deceptive sales and enrollment tactics. Plan sponsors and their representatives, include agents and brokers, must follow strict guidelines when they wish to market to beneficiaries. Make sure you report possible Medicare marketing violations and enrollment fraud errors and abuse. If you received unsolicited calls from a company you have no prior relationship with, a company represents itself as coming from or sent by Medicare, Social Security, Medicaid. If you receive information such as leaflets, flyers, door hangers, etc., on your car or at your residence from a company you did not have an appointment with. If you have been contacted by agents to discuss about other insurance products such as life insurances, annuities during a visit or meeting with a Part C and Part D Medicare product. You signed up for a plan after being told by a company that certain prescriptions were covered, but after reviewing your explanation of benefits, you found they are not covered and you received a bill instead. Step 3, make sure you report it. When you report Medicare fraud, errors, and abuse, address it immediately by taking these steps. Rule out any errors by calling the provider or plan and asking for an explanation. Get help from your SMP. This is a free and confidential service. SMP and their trained volunteers can help with questions, concerns, and complaints about potential fraud and abuse issues. Rhode Island SMP, you can contact Rhode Island SMP at 1-888-884-8721, or you can visit us at www.oha.ri.gov, or you can even find us on Facebook at riship.smp. Get help from other sources. Contact your local law enforcement, call 1-800-MEDICARE, or you can report it directly to the OIG Office of Inspector General hotline at 1-800-HHS-TIPS. Local help is near you at all times. You can contact the SHIP SMP coordinators and volunteers at the following agencies: Tri-County Community Action Agency, Johnston Senior Center, West Bay Community Action Agency, South Kingstown Senior Center, Westerly Senior Center, The Point, our Aging and Disability Resource Center, West Bay Community Action, Leon Matthews Senior Center, Progresso Latino, Child and Family Services of Newport County, the Edward King House, and of course the main Rhode Island SHIP SMP line. Thank you for attending. Feel free to contact us if you have any questions. My name is Kim Timpson. I am the Health Insurance Coordinator, and it's a Human Service System Policy Specialist. You can contact me at kim.timpson@oha.ri.gov. And our SHIP and SMP volunteer coordinator is Jennifer Rees. You can contact her at jennifer.rees@oha.ri.gov. Have a great day.